Hello, all of you. Is my micro working? Do you hear me? Yeah, great. Okay. Welcome. It's 3 o'clock. The day is starting to be a bit long, but I'm sure we'll be energized again by the presentation of our speakers. The session will be only in English. So we'll always only speak English, and it's going to be translated into French for everyone that needs it. So if you need a headset, please let us know. Welcome to our online participants. So as you've heard, the session will be in English, but you can translate by clicking on the little headset on your screen. So I'd like, you know me, I'm Marianne Moldere. I'm going to moderate this, facilitate this session, but I won't be as active as I was this morning because there's a lot of things to say, and I'll leave the floor to our speakers. In this parallel session, that's going to talk about transforming education, ITC for a better and inclusive learning process, and which solutions, which EdTech solutions are there. I will leave the floor to our first speaker, which works for UNICEF. She is called Leotos Lugo Erin. She's education manager at UNICEF Education Hub, and she's going to present us the EdTech for Good framework, which is actually integrating, analyzing, validating tools, if I'm not wrong, identifying safe tools to put them in a learning cabinet. That's an online platform accessible, I guess, for everybody. But she will tell us all about it. The floor is yours.
Thank you. Good afternoon, everyone. I'm just checking if you could hear me.
We can hear you, but we cannot see you yet.
Okay, yeah.
There you are.
Can you see the presentation?
No.
I think that colleagues
it will be coming, the presentation, the slides. Yes, there we go. But we don't see you anymore. I don't know if you can see both.
Yeah. You can hear my. I'll just speak through with the slides. But thanks again for having me. And Marian, as you mentioned, I work with the UNICEF Global Learning Innovation Hub here based in Finland. And apologies, I couldn't join in person. But I wanted to, before going into the details about our work around EdTech for Good, I wanted to briefly share about this hub that I'm working with and why we're here. So next slide, please. Because we are a very new hub, only launched at the end of 2022, that really focuses on digital learning. And the reason why is that, as you can see in this slide, it's because of the learning crisis. We also call a learning catastrophe. As most of you know, 70% of 10-year-olds in low and middle income countries cannot read a basic statement. But also in developed countries, OECD countries, the latest results of PISA really showed a dip in learning outcomes. Next. So this is where we are, the Learning Innovation Hub. This is basically the opportunity where we have come really trying to help address the learning crisis by leveraging advances in technology. Next slide. We are, as we say, trying to be the global home of the architects of the future of learning, based in Finland, but with a global function, working with our UNICEF offices across the globe. At the same time, bringing not just our traditional education partners, but also the non-traditional ones, including the private sector, the tech industry, and others. Next. So as mentioned, we have a really zoomed in focus on trying to harness all these EdTech innovations. I think the whole day you've been talking a lot about technology. So we are really here to try to see how all these innovations, particularly on EdTech, can benefit all children so that they are learning to address the learning crisis, but also to start shaping the future of learning. Next slide. In terms of education technology or EdTech, as we know, there are really a lot of EdTech tools available around the world. This slide, I wanted to capture how, I think, based on estimates, they say there's about 100,000 easily EdTech tools, and they are also rapidly changing with all these developments in artificial intelligence, in AI. And this makes it really difficult for countries, for ministries of education, for schools to decide then what EdTech tools to use in schools. Next slide. In AI alone, particularly with the advent of generative AI, as we know, it's being used across the different aspects of education, from the learning process to curriculum to assessment, administration, and teacher support. You can see here, these are small icons of the different apps or browsers that use AI across the spectrum. And this is not an endorsement from our side, but just to give you how vast basically the number of EdTech tools there are globally. Next slide. So basically from UNICEF, because many governments, also ministries of education that we work with, also ask us, so then how do we decide which are the right EdTech tools for teaching and learning? And we thought for ourselves as well, how can we help our decision makers, ministries of education, school principals, even parents, really to understand and find EdTech tools that suit their specific needs and context. Next. So with the Learning Innovation Hub, we have 3 key pathways, 3 key interventions that aim to find the right EdTech tools. One is EdTech for Good framework. The second is a learning cabinet. And the next is the Blue Unicorn Farm investments. I will explain all of this in detail. But for me, the key point, I think for most of you as well, when you try to find or choose an EdTech tool, what is it that you consider? What are your considerations? I managed to catch the last part of the previous session, and one was the context is really important. You can deploy EdTech tools, but there is no devices or there's no connectivity in the schools. The other one is safety, policies, who are your target audience, language. So I think there are really different considerations, but the important one as well is context. So what we have done with UNICEF is we developed what we call the EdTech for Good framework. It's really a set of principles and criteria that we aim to use in curating and reviewing different EdTech tools, but that we also hope our different our ministries of education and development organizations working in education can also use as reference. We developed this framework way back last year, and we had also our partner, the Asian Development Bank, ARM Holdings, but we brought together experts from different fields, from learning pedagogies, but also broader education, but at the same time from the EdTech field, cybersecurity as well, venture investments, to really get this diverse expertise and think through what are the criteria that we should follow in choosing EdTech tools. We tested this with 15 EdTech companies, and at the same time, as of 2 weeks ago, we have been reviewing over 100 EdTech tools using this framework. So what is in the framework? We have 5 pillars, and I'll go through them in the next slide. It also shows, we have these 5 pillars, as you can see on the screen, and the key point here is that these are principles that we really hope EdTech companies, EdTech providers can adhere to. One is safety first. It's really important that the products are safe. Products we put in the hands of children or teachers are safe, that it has a proven impact on learning, because there's, as mentioned, easily 100,000 EdTech tools, but maybe not all of them is actually giving the desired results in terms of helping children learn. The third one is that it is designed for children. The fourth is ready to reach all. And the fifth is it leaves no one behind. The theme of this conference is really about inclusion. And this is also where we highlight all these inclusion and accessibility elements. So when we talk about safety, the framework actually has over 120 questions, criteria, and they are broken down into these different like subtopics. So data protection and privacy, information security, also safeguards, AI guardrails. If a tool uses AI, what are the guardrails that they have? In terms of impact on learning, what is the theory of change? What is the research backing it? What's the evidence? Is there, if available, what are the feedback from the different stakeholders that use it? And the engagement, for example, users and growth. At the same time, a very important factor, and UNICEF being a main organization on child rights, it's really about that it's children at the center of the design of this EdTech tool. So the pedagogical design, does it follow learning science, for example, and the user experience as well. Many countries that we work with in the Global South especially also have a major consideration in terms of scalability and costing. That's why the framework also looks at the infrastructure requirements of the tool, the local adaptability, can this be mapped to the local curriculum, translated, as well as the business model and the pricing strategy. And the last one, but equally important, is on the accessibility features, there's equity, as well as gender. So some of the questions, for example, that we ask when we review EdTech companies is this: does this product or does this tool work without connectivity? Does it have an offline functionality? Does the product meet the web content accessibility guidelines to make sure that it is accessible? And many other questions. So just to give you a sense. And our hope is really to have for this framework to also be useful for other organizations that work in education as you try to really assess different EdTech tools. How are we using this framework as well? Is that we use it, as mentioned, to curate different EdTech tools, and we feature these tools that pass the criteria on what we call the Learning Cabinet. It's an online platform to discover the best EdTech tools from around the world. As mentioned earlier, there's a constellation of different EdTech tools globally, and we just want to pick the best of the best, a handful of the best EdTech tools that are inclusive, accessible, scalable, safe, and have a high impact on learning. How are we finding these tools? So we have a sourcing strategy, really looking at tools from around the world, not just from one country or one region, but around the world, also from different providers, even from usually, of course, public sector, but universities, NGOs, and different partners. For now, we have a beta version of the Learning Cabinet, and we will launch it actually at the end of November. And we can share as well more details around it. So the third component of our work is what we call the Blue Unicorn Farm. We have in the hub what we say a Blue Unicorn moonshot, and moonshot because it's very ambitious. It's like when in the late 1950s, 1960s, when people were talking about putting man on the moon, it sounded really impossible, but in the end it happened. So our moonshot is to challenge this concept of tech companies looking for at least US $1 billion ventures, to challenge this notion, but instead to look for ventures that impact 100 million children with quality learning experiences. So instead of the dollar valuation, it's the impact on children. So right now, we are looking for companies, EdTech providers, and this is our first batch of companies that we work with, that focus on foundational literacy and numeracy, school readiness, the inclusion of children with disabilities, empowering teachers, and future skills. In summary, basically, we have, as mentioned, we have these three pathways. One is the EdTech for Good framework. I want to emphasize that this is a beta version because we really, the industry is changing a lot, so much that we want to also keep pace with this change. So we continue to update this. And we also hope that EdTech startups, EdTech companies can use this as a reference as they develop further their products. We use the framework to assess different EdTech tools, and the ones that meet the criteria will be featured in the Learning Cabinet. And of those featured in the Learning Cabinet, we really pick a handful and try to invest in them, basically trying to pilot them with our partner countries, for now in 6 countries. So that's our Blue Unicorn Farm. So this was our pathway in terms of really looking at EdTech for good. And one last thing I wanted to share is also the work we are doing with teachers. Basically, we know that around the world, teachers are really catching up on how to leverage digital learning technologies in education. So what we have done is that we have developed what we call a superstar teacher toolbox for now with 2 tools in it. One is on digital pedagogy. The other is mobile messaging for learning. And we hope to develop more on this one as well. And the idea is that these tools are very practical tips, not frameworks or guidelines, but very practical tips to help teachers integrate effectively technology in teaching and learning. This is the end of my slide. So if you want to know more, you can also contact us. This is our email and this is our website. Over to you, Marian. Thank you very much.
Thanks a lot, Leotos. You were just on time. I was about to raise my mic to say you have 5 more minutes, but I didn't have to. Thanks a lot. So the floor is yours, and yours also, people online. Please let us know what you think, which questions you have about this impressive development. I'll give you the floor. Please stand up again with your name for the translation.
Thank you very much. I'm Mariko. I have a question regarding how do you keep track of all the EdTech tools that appear every day around the world? I mean, I thought the idea was really amazing, and I was really, truly respectful that what your activity is reflecting on. But sorry, it's a bit too much practical perhaps, but yes, I was wondering, how do you collaborate or capture global, very vivid movement of the, yes, those innovative tools popping up every day? Yes, that was my question.
Thank you. The floor is to you.
Thank you, Mariko. Very important question. And in fact, we do have different ways at what we call a sourcing strategy to make sure as well that we really find these tools from around the world, because usually when you search online, you tend to find mostly from basically from the north, from developed countries. What we do is that we try to partner and search different what we call incubators, accelerators, that ventures that work with EdTech companies, but we also have access. We subscribe to a global market intelligence platform that tracks many of these EdTech tools. So we have this very proactive approach. And of course, if you know any companies, please let us know. And participating in sessions like this also help us keep track of what's out there. So we are always on the lookout, but and I really want to emphasize that we want to really search from around the world. I hope that answers your question.
Any other questions?
Thank you. I'm Flaminia and I represent Prometric which is an EdTech organization based in the US. The headquarters is in the US. And I am particularly interested in this research that UNICEF is carrying out. And I just wanted to understand in terms of timing and logistics, you said that there was a first cohort that had been identified already. So I'm wondering about the next steps, because this is something that I would like to bring in internally within our organization. So to understand a little bit more who we can reach out to receive guidance, because as we all know, whenever we need to apply, particularly online, it might be interesting to have questions, to be able to report questions to someone. So if you have any advice from this point of view. Thank you.
Thank you. I'm really a good question as well. Indeed, we have already started looking for some of these solutions, and this is just the first cohort. We via our networks, we basically made a call for applications, but at the same time, the application for the learning cabinet is open the whole time. So the easiest and fastest is to contact us at the Learning Innovation Hub at unicef.org. I think I can also share again the email, and then we could share you the details on this processes of applying, and what are the requirements and the timelines as well. As we move forward, because this was also almost like a pilot, a first test case of how the systems we've set up work. As we move forward, we will also have a broader really call for proposals, call for expressions of interest, and that hopefully will also happen early next year. But do email us, and then from there we can provide more information.
Thank you. Any other question? I have a question. Do you set a label on EdTech solutions that are kind of approved and get into the learning cabinet? So how does the average teacher know when he doesn't go in the learning cabinet that this is a safe, inclusive, and so on EdTech tool?
Thanks. Yeah, with the learning cabinet, the idea is that this is easy it's like a website, it's easy to search. So we will have information about the products, or you can search by the tool, or by or what kind of tool you're looking for. So if I'm looking for a math tool for primary students, I could put that down. Or so something we tried to call it before, like almost like an Airbnb of EdTech tools, right? So that it's easy to search. And we're also continually testing the learning cabinet with the target audience. So when we launch in November, it will be as well a beta version, and we continue to test and get feedback from the users to improve the search functions. The other one I wanted also from the previous question, I forgot to highlight that we are looking not for very, very early stage startups, but rather a bit more mature, so that there is actually evidence of impact, that it might be working in a different country context. But our idea is that we basically help promote tools that are safe, impactful, and have a high potential, especially for working in the global south.
Thank you very much. If there's no further question, please stay with us, because we'll still have a closing remarks. And I'll invite Antoine and Aline to come over and present us the way MSF is dealing with digital training in Central Africa, if I'm not mistaken. Republic of Central Africa.
Exactly. Okay.
You share?
Yeah.
Yeah, we can share. Good afternoon, everyone. My name is Aline Filio, and I'm the pedagogical referent at MSF Academy for Healthcare. And Antoine?
Yeah, and my name is Antoine, and I'm the e-learning content developer for the MSF Academy. So I'm supporting in everything related to online education in the healthcare academy.
Okay, I'll start with a general introduction of who we are, because I think we're maybe an unusual organization in this platform. And then I will let Antoine really do the interesting stuff. So,
that's not the latest PowerPoint.
We have an old PowerPoint. That's okay. We can deal with that. Right.
It's not the latest one we sent.
Oh, it's fine. Let's. Yeah, we had so. Well, it's good for the French speakers. You can follow in French. So who we are? We were created in 2017, so we're quite recent. I won't go too long for the history of us. And we really are answering the will of MSF to invest in continuous professional development for our medical and paramedical staff in the projects where we work. So we started implementing training programs in 2019 only. And our training programs are really aimed at improving the quality of care for our patients. So it's really hands-on, it's competency-based, and it has a lot of on-the-job training. We train MSF staff, but also the Ministry of Health staff, because many of our projects are in support of the Ministry of Health facilities in the countries where we work. What else? Yeah, we try to work in, how we do this, we try to work in partnership. We try to build partnerships with universities, with schools, with the Ministry of Health, of course. So sometimes it's to provide degrees. Maybe we can go to the next. Oh no, because it's not there. It's not there in this one. Okay, but so we try to have academic degrees when possible. So we have partnerships with 2 South African universities, for example, for postgraduate diploma. We have also partnerships with the Ministry of Health, because we try to have our continuous professional development programs recognized as continuous professional development credits where it exists, or at least co-certified by the Ministry of Health. Okay. All right, so today we want to speak about one of our programs. We train our medical doctors, we train our medical coordinators, but our largest audience is actually nursing staff. And this is where maybe the needs are acute, I would say, because we work in remote areas, we work in areas where security is often a problem. So there is a big gap in qualified nurses in those areas, either because the country schools cannot cover those needs and don't train enough nurses, either because the trained nurses don't want to come in those areas that are lacking security, where they cannot bring their family. So we have really a problem to find qualified nurses. A lot of the staff providing nursing care is actually not qualified nurses. So they're nurses assistants, they're sometimes first aid workers. So we really need to train them to make sure that they can deliver quality care for the patients. So we have in-person programs. Most of our programs are in person, and for the nurses it is mostly in person. Sometimes we have hybrid programs, and we also have distance learning program. This one for nurses is initially face-to-face. But we did develop e-learning because we foresaw that in some places we wouldn't be able to send trainers. So we train trainers, but sometimes in projects where we need to sometimes quickly evacuate our teams, we cannot have many people in the project. So in those projects, e-learning we thought would be a solution, and we could have maybe one trainer focusing on bedside. We do a lot of bedside in service training, and then the more theoretical part could be done with the e-learning. That was the initial plan. But quite quickly we realized that there was another use for e-learning, because our continuous professional development programs are between this one is an 18 months program, so it's about 3-4 hours a week for a staff member. They have bedside training and they have classroom skills lab or e-learning. We realized that it's such a long-term program. I mean, in MSF world, that's a really long-term program. We had a lot of people who were missing sessions because sick leave, because maternity leave, because emergencies, because overwork. So we had to find a solution for catch-up sessions. So initially the trainers started to organize catch-up sessions. But when you have 100 staff to train, the trainer becomes quickly overwhelmed with catch-up sessions. So we thought, oh, okay, let's try and use the e-learning for that. So that's what we did. Our solution, Antoine will present. But we are presenting what we did in Bangui, in the Central African Republic, because MSF likes a challenge, so we thought it would be a good idea to do it in a place where the hospital has no internet and where the staff doesn't have any smartphone, or most staff don't use smartphones. So yes, and Antoine will tell you about this.
Okay. Is there sound or no? No? Yeah. For the video. I don't know if there is a possibility. Wait, there is. Yeah. Is there a possibility to play the video or? Okay. Okay. Okay, perfect. So mainly, okay, what we're going to talk about is mainly about the pilot test that we did. So we mainly went to Central African Republic, and there is a big problem in internet. Just to give you an idea about the internet connection issues, just to send, sometimes just to send a WhatsApp message, it can take 2 to 3 minutes. So it's just like loading and it's connected to the internet. So, yeah. So for us, as Aline was talking about the basic clinical nursing care, we have the online version of it. And this e-learning, it's interactive activities that were developed, and to be able to access it, we need to use our platform with the LMS platform called Tembo. It's the learning management system of MSF, on which we have the courses that we use. So what is the main issue in the country was to be able to implement the online courses. It's so hard because learners don't have to open like an activity that's 10 megabytes, it can take more than 15 to 20 minutes on one tablet. So to be able to open it for, let's say we have 10 learners doing the activity at the same time, so we need to download the same activity 10 times, which impact the infrastructure of the internet of the project. So it's kind of impossible to do it that way with normal connectivity. Even though it's not like we have like a limit of the size of the files, but at the same time, it doesn't work. Yeah, so I just, in the beginning, there is like a video that shows what happens. Yeah, the project, but it's okay. Yeah, that's the new one. Perfect. So here is the nursing and midwifery care. So yeah, as Aline was talking, staff can't always attend the face-to-face session. There is a high turnover among staff. And because of that, trainers spend a lot of time doing catch-up sessions, okay? So for us, the solution, as Aline mentioned, was to use the e-learning. Now, let's check the video. I don't know if it will be with sound. Play. Will it? Yeah. If it's without sound, 1 second. Can I?
Hello, my name is Gerald from Tembo Technical Team.
Okay, I have an idea. Anyways, I can play the video from my phone, and that way we have the sound here. Yes.
Hello, my name is Gerald from Tembo Technical Team.
And my name is Antoine, and I'm from the MSF Academy.
And we are currently in Bangui in Central Africa Republic.
The MSF Academy has been operating here for a few years now. And by the end of 2023, we started a 2-year program aimed at training over 130 nurses employed at the Shuk Hospital, one of the largest hospitals in the country. This program includes many e-learning activities accessible via Tembo. However, we always had challenges implementing it due to internet connectivity issues.
La raison de démotivation, c'est par rapport à la connexion, parce que tellement que tu vas sur Tembo pour ouvrir un cours, ça prend trop de temps, et vu la charge des activités aussi, ça fait que il y a eu une démotivation d'aller faire recours sur Tembo.
So we came for 2 weeks to pilot test a tool that might help them solve the problem. After 1 week of preparations, the Biki Hub was ready to test with the learners. This tool can provide offline access to Tembo in places with low or no connectivity. It also saves the
During the pilot test, 82 learners of the MSF Academy in the Shuk Hospital had the chance to experience Tembo for the first time.
Oui, avec l'expérience de l'utilisation des tablettes, c'est une expérience qui est vraiment formidable. Ça m'aide beaucoup parce qu'avec le tablette, je me perfectionne le plus vite et puis on avance le plus vite. Il y avait les lectures, je le vois et puis il parle. Ça...
Alors je vois avec le nouveau accès avec Biki, ça va être une meilleure solution d'avoir accès. Et je crois que ça va motiver les personnels à aller sur Tembo pour faire un cours.
Okay, so as you've seen, this just gives you an overview of the problem. So the tool that we use to solve this problem is called the Biki Hub or Biki Box. So this Biki Hub, the idea of the tool, it just creates like a hotspot, and then using a tablet, you can just connect. It creates a Wi-Fi spot called Biki or something, or however you want to call it. You can just connect. And then using your browser, you can just go write biki.box, and then you have a Moodle platform on the box. So we uploaded all the courses on this, and then that way the learners have access to it. And at the same time, they can also use the Moodle application. So it's not only dependent on the navigator, it can also benefit from all the Moodle application. So what is also interesting about it is that it has an Ethernet cable port. So that way, whenever you can plug it, you can connect it to the internet, and that way you can synchronize the data of the learners. So the progress of the learners, we can synchronize it. That way we can have access to it. We can control the Biki Hub, and if there are problems, we can just diagnose it. We have our, there is like this cockpit that can diagnose and then can check everything. You can change the password, we can do whatever we want. And then we can add new content. So if we have like new units that we would like to add, we found that there is like feedback from the contents from the learners. So we just improve the content and stuff like this. And this, we're always doing it with Tembo, which is like the team in charge of the LMS of MSF. Okay, so how did the sessions work? First, when we arrived, we did something, the configuring the tablets. So we had the tablets and we needed to configure it so that it can work with the platform, with the Biki. So to do this, we had 40 tablets around, and we needed to configure everything with the slow internet. So it took us like 1 week just to download the Google Chrome and the Moodle app. And we didn't do everything. We did like around 10 tablets. And then for our programs, as Aline was saying, we have mentors that are there that are facilitating the sessions. So we trained the mentors on the tool, and we trained them on how to use it, how to create accounts, how to provide support to the learners. And then we had like sessions every day in the week. There is like a 3-hour session in the morning and then 3-hour session in the afternoon. So to like let all the learners test it, we did few sessions with them. We had around 10 to 12. It depends on the group. And yeah, we were testing it with them. So we trained first the learners. The learners, it was the first time for some of them to touch a tablet in their life, so they don't have any digital literacy, and that's in the capital, so you can imagine how bad it is outside of the capital. And those are nurses who work with the Ministry of Health. So mainly we train them on a little bit basics of how to navigate with the tablet, how to turn, open, close, how to move right, left, and stuff like this. Yes. And then we did an observation of the learners, so we let them work on it, and we were observing how they are interacting with the tablets, what are the difficulties they are facing. And according to the observation, we noticed, for example, that one of the things that was interesting, that everyone needed a paper. So even though we were working on digital platform, they needed a paper to write notes, to like do everything. That was interesting to see. And some of the stuff that are really obvious for us might not be obvious for them. Like, for example, an arrow. When you see an arrow, you click on it to go to the next slide or to the next page. This wasn't obvious for many of the learners, even though we explained it and we told them, to navigate, you need to do this. But it wasn't that simple. And then after the observation, we had like a discussion with the learners. So it was mainly a discussion about how they felt about this, what they think about using the e-learning and doing activities on tablets in comparison with the face-to-face activities. We had it was very interesting to see the positive feedback that we had. Well, there was people who were suffering a little bit, but it was the first time for them. So they were, it's our first time doing activities on the tablets. So maybe with time we will get better and we will learn how to use those tools. Others who were more like, and there is one of the comments also that I've heard was, the world is moving around us and we're still in and we're not moving forward with the world. So using tablets, it's a good thing because now we're feeling that we we belong to the world that's moving with the technology and everything. So that was the empowerment part that we heard. There was also people saying, yeah, it's better because here when we work, it's more interactive. There are questions I need to click, I need to do stuff. It's not like the face-to-face facilitation when we have the mentor just speaking and we're listening to him. So everyone has his own thing and he's working on it. So that was some of the feedbacks that we had. And after this pilot, we decided to do we decided to take few other steps. So for example, we decided to keep the mentor to support the learners, because just providing the tablet to the learners without the help of a mentor, we found that this would be very difficult, and especially in the context in which we intervene. So it's not completely self-paced. We developed a training for mentors to be able to facilitate with a tablet, because facilitating with a tablet is completely different than facilitating a face-to-face session. There are like things that they need to take into consideration. They need to prepare for the sessions, like they prepare for the face-to-face. They need also to prepare for the e-learning sessions. They need to know not only, they don't only need to be subject matter experts, they also need to have like some technical background to be able to help or debug or solve any technological issues that can arise with the learners. We also tried to decide, we added more navigation aids and stuff in our e-learning courses. And yeah, we're using Biki in other programs and contexts. We did another pilot after that in South Sudan, but yeah, we don't have the time to speak about it. So 54.
So it was a real life experience. With we could see your flexibility and your resilience to to get on offline, on off sound. Thanks a lot. Any questions? Any remarks? Any reactions?
Thank you, Flaminia. The Biki that we saw, it's like a hotspot. Is it specific? Like, is it something that you particularly chose because of your needs, or is it any of many existing on the market? Like, why that one specifically?
Okay, so the Biki box, there was like the office in Geneva, they used it previously before us, so they tested it. And then now there is like a field accessibility project that Tembo, the team of Tembo is in charge of it. And they have different solutions. And this is the first tool that we are testing, it's that the Tembo team is testing, and we're doing the partnership with them, is the Biki. But at the same time, they are testing other tools also. But the Biki, what we did, what's good with Biki is that it's a startup. It's not like it's a startup, but not very startup. Yeah. So they are flexible. They are working with us on developing the tools. So, for example, in the first pilot test that we did, we had like a feedback to the team, and they developed the hardware based on our feedback. So we had like recommendations. We would like to do this with the hardware. For example, there was like something simple when you plug the internet. Some IT stuff, but when you put it on the internet, it creates a hotspot, and the hotspot provides internet to everyone on the feed. So any device that was connected on the hotspot will have access to internet, and this is not what the IT want. So we managed to stop this hotspot to provide the internet to the connected devices. So things like that. We added like a light to whenever you plug it to the internet, that way it appears that it's online. So that's why we're working with them. They are very flexible with us. They are very helpful, and yeah. But at the same time, we're gonna try other solutions also.
Anyone else? Any questions online? No questions online, so...
I have more of a remark. Would that be okay?
Yeah.
Hi, my name is Ira. I just want to say thank you for everything that you do. It's extremely inspiring, and it just shows how when you want to find a solution, it is possible, or there are ways. My only question then would be if you could do, or if you could like improve the module that you have what would you do? Like, what would be the next step?
Okay. So the question is more about the content.
Yes.
Or the
absolutely.
training. Yeah. Okay. So for the content, for example, we tried, and what we tried to do to improve it is to put more navigation aid, as we said. So that way, it's more. They know where to click, even though it's explained in the first slide, it can be repeated again after. So that's one of the things that we did. Another thing is we had this comment that because French is not their native language, for example, in core, they speak French, but sometimes it's hard. So that was an issue. So they asked for more visual stuff. So not a lot of text, but less text and more visual, more animation, more things like that. So that's another thing that we are taking into consideration. A third thing also is that we're trying, because this is like continuous development programs, so people are already working as nurses. So what we try to do to the content of the new units that we're developing is to have it more like cases. So they have practical cases and they need to solve it. So it's not like theoretical content, just we're telling them, you need to do this, you need to do this. They have this patient and they need to follow him, and they do actually what they are doing in their work. So that's another thing that we did. Another thing also that we found interesting when we did the pilot test in South Sudan is, even though it's e-learning and it's one person, when we do like two persons using the same tablet, sometimes there is peer learning. So one can translate to the other one. They can support each other in their work. They can discuss, so whenever they have like quizzes or questions, they start discussing it together before solving it, and that was also interesting to see. So we're trying to observe different behaviors and accordingly like do our e-learning strategy.
We have 1 more minute to go, so I just would like to ask Leotes, who stayed with us all the time, and I will ask you the same question. One takeaway that the participant should be here. One advice, one tip. Which would it be? First, Leotes, and then the two of you.
Yeah, thanks, Marianne. I think for me, it's really that as technology is evolving so fast, it's really important that if we deploy and use technology in education, we think about safety, about equity and inclusion, and not widening the divide. And most of all, it's not about technology. It's about the child, the learner, and the teacher. So putting them at the heart of all of this is really key. So I think for me, that's the key message.
Thanks a lot. What about you two?
Yeah, I don't know. I liked the one from Mona, I think earlier, that talked about perseverance. and I think when we try, and we try enough, and we try long enough, we can get there. At least that's what we are seeing in MSF. Yeah.
Thank you. Let me ask you to applaud speakers. Thanks for being there. We'll see you just now, no pause, in the main room for the closing. Thank you very much.